It's a silent heart disease, so we are not expecting any warning signs. So how do you see these patients?
Individual with the diabetes mellitus, they may have reduced sensation, perception to the pain. Individual may have the heart problem. He may dismiss it as a acidity, indigestion, and other issues.
Red flags that you would want to give out to all our viewers that you might be at a risk of a silent heart disease.
All the high-risk individuals, those who have had previous heart disease history, those who have strong family history means
Hereditary wise.
those who are suffering from diabetes.
Can silent heart disease be reversed? Sitting is the new smoking. Your thoughts on that?
Very true. Because sitting increases the weight, overweight, and obesity. We know that this is a traditional risk factor for heart disease as well as other lifestyle-related diseases.
Every meal, every stressful day, every skipped workout, it all adds up, quietly wearing down your heart. You might feel fine now, but silent heart diseases doesn't wait for symptoms to strike. The very choices you make around food and lifestyle could be ticking time bomb in disguise. This episode dives deep into the hidden ways your habits impact your heart and what you can do before it's too late. Because sometimes the most dangerous threats are the ones you never see coming. Joining us today, we have Dr. Jagjeet Deshmukh, a distinguished interventional cardiologist with deep expertise in both invasive and non invasive cardiology. He is trained at prestigious BJ Medical College and UN Mehta Institute, renowned centers for cardiac care and research. Known for his mastery of advanced 3D echocardiography, Dr. Deshmukh excels in diagnosing and managing complex heart conditions. He has played a pivotal role in critical interventions like primary PTCA for heart attacks and device therapy for arrhythmias. A respected academic and prolific researcher, his work continues to shape modern cardiology in Pune and beyond. Hello and welcome to another episode of Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Jagjeet Deshmukh.
Hi.
Hello, sir. How are you?
I'm fine and keeping busy.
Keeping busy. I'm pretty sure because cardiac OPDs are usually very busy. So, how does it feel to come on Sahyadri Health Talks?
Yeah, it's always pleasure to talk to you.
Because this is something which we are doing to create a lot of awareness regarding different, ailments and. Considering that there are so many information available on internet right now, and it becomes quite difficult for patients to comprehend and understand which one to take it live, so it's always better to hear it out from the doctor directly.
Yes.
So that's the reason that Sahyadri Health Talks. And now, so as you said that you're keeping quite busy, so I'm quite interested in that part of it. So how does a day in Dr. Jagjeet Deshmukh's life looks like?
It's like any cardiologist, it's a hectic day. Starts early morning. We rush to the hospital, takes the round, do the procedures, see the patients on OPD basis, and in the evening also attends the emergencies and evening round and go home.
So you are kind of over 22 decades you are doing this.
Yeah,
So
it's
have
been
you
like that.
have you been able to do the balance between juggling between OPDs to OTs to cath labs to yeah.
Yeah, the every day is different, but yes, most of the days we are able to manage these things.
Yeah. So silent heart diseases, that's what we are going to talk about today, right?
Yes.
So one thing which the the terminology itself says that it's silent, so it definitely doesn't show any symptoms.
Yes.
So help us understand more about this silent heart disease.
Yes, traditionally heart diseases present with the classic symptoms like chest pain,
Yeah.
breathing difficulty, or fast heartbeat.
Mhm.
But sometimes they may not present with these symptoms. An individual may be diagnosed with a heart problem, and that is called as a silent heart disease.
Acha. So who are these individuals who are at greater risk of silent heart diseases?
Generally, individuals with diabetes mellitus, patient with advanced age, those who are having elevated cholesterol levels, high blood pressure which is not under control, and those who don't used to go to the doctors routinely for checks. So these individuals may suffer from these elements.
Okay, okay. So as the word says itself, I mean, it's quite clear in its own that it's a silent heart disease. So we are not expecting any warning signs. So how do you see these patients coming to you? I mean, what are the circumstances in which they come down to you?
Generally, silent means it could be two, three different scenarios. As I mentioned earlier, individual with the diabetes mellitus, they may have reduced sensation, perception to the pain. So at any point of time, if they don't have the symptoms and if they go to the doctors, they may find at a one point of time, doctor tells, yeah, you are having this problem. So first is diabetes patient. The second would be individual may have the heart problem, but he may dismiss it as a acidity, indigestion, and other issues. So these are the different scenarios where you may not be able to concretely diagnose your problem until it's too late.
So what kind of screenings or tests that you suggest in such individuals, or for that matter, any normal person to undergo, so that I don't know whether I am at risk of silent heart disease today? So how do I find that out?
Generally, old patients, patient with diabetes, patient with high blood pressure, patient with high cholesterol, and pre-existing heart diseases, they are likely to develop the silent heart disease. They should visit the clinician. Cardiologist will assess them. There are different sets of tests like ECG, which is electrocardiogram, then 2D echocardiography, stress test, which is also called as a treadmill test, and coronary angiogram, either conventional angiogram or CT coronary angiogram. So these tests may not be individual diagnosed, but arrive the test as clinician find it relevant, will able to diagnose the heart disease at earliest.
Okay. And what role does stress, sleep, and mental health has to play in this? I mean, do you see an increased incidences with this?
Exactly. In recent times, we are seeing the lot many young individuals at a risk of heart disease, and stress, psychiatric elements like depression, anxiety, and lack of sleep also plays an important role in any of the heart diseases. As we know that stress, long-term stress increases the cortisol level, it increases the blood pressure and vascular inflammation. All these factors increases the risk of heart disease in any individual.
So compared to a regular, cardiology condition which shows symptoms, compared to that, how is the treatment approach different for silent heart disease? Is my first question. And second is, how are the outcomes? I mean, how much effect does it have on the prognosis as well as the mortality rate?
Yes, obviously, as the name indicates, the silent heart disease, when the individual present to a clinician, already it has been delayed, the damage has been happened. So obviously, prognosis is not good as when individual comes in early, but it's not totally too late. You can halt the progression of disease if you intervene early. But yes, obviously, the prognosis may not be as good as when you intervene at the early stage.
So, are there any statistics or studies which, stresses further on this?
Yes, generally the diabetic individual, long-standing diabetic persons may have heart disease, and nearly 50% of the heart attacks in the diabetic may go unnoticed until it becomes too late. And those presenting late obviously has a higher risk of cardiovascular mortality than the individuals who have been diagnosed at earlier stages.
So, how critical is the timely intervention in case of silent heart diseases important in preventing, worsening cardiovascular outcomes?
When individual present diagnosed with the heart diseases in early phase, there is scope of medical therapy, there is scope of lifestyle changes. But in silent heart disease, already the damage has been done. But as I spoke earlier, it's not too late. Individual may be diagnosed with advanced heart disease, but the limited role of medical therapy may probably ask the clinician to opt for the more aggressive therapies like angioplasties or bypass surgeries.
How does it? How does a diagnosis and a treatment approach for a silent heart disease, uh, you know, uh, comes out as a challenge for you and the team? Because this is something that the patient is completely unaware about and comes to you in a condition where it is in an emergency condition most of the times. So how much challenging that becomes for you and the entire team to work on, and what are the different other aspects which you need to look into in such patients?
When individual has the symptoms, obviously he knows that something is not correct. So the acceptance is quite high. But and when individual goes to a doctor and he finds at one point of time that he is having heart disease and that to or such as extent, then it becomes psychologically very demoralizing for him to accept the things.
So there's this phase of denial that
Yeah,
comes.
initially definitely the phase of denial. He may seek the second, third opinion, but yes, obviously you have to explain them
So counseling
individuals
plays a
crowd.
very important
Yeah,
role, is what
counseling
you're
plays a
saying.
very important role, and you need to sympathize him that even at this stage of disease you can halt the progression, or in a few cases you can reverse the condition.
So what was the youngest patient you have seen with silent heart disease?
Youngest generally in mid 30s.
Mid 30s. And they accidentally report to you, or
Yes,
how?
obviously, they may came for some different reasons, and when we do a test, as we'll mention, like ECG and 2D echo, we find that there is some abnormality, and when we further evaluate them, they found to have the blockages, they found to have the diseases in the arteries, and then they have to explain or counsel them that these individuals needs the treatment for heart disease hence after.
So what would be a takeaway symptoms, or red flags that you would want to give out to all our viewers, that you might be at a risk of a silent heart disease? What would be the red flags or takeaway messages?
All the high risk individuals, those who have had previous heart disease history, those who have strong family history, means
Hereditary wise.
hereditary wise, those who are suffering from diabetes, which is not under control, to be precise,
Uncontrolled diabetes.
uncontrolled, patient with the high blood pressures, not on medical therapies. These subsets of people should visit at least once in a 2 years or once in a year, ideally, to the doctor to check themselves, to do certain tests, maybe some ECG, 2D echo, some lab reports including lipid profile, blood sugars, inflammatory markers, to stress test, to find them that whether their heart condition is good or they are suffering from any diseases.
So one thing which we always know, and for the matter of fact, the role of estrogen in keeping young women comparatively at a much safer rate, or a safer place than men when it comes to heart attacks, right? So does this estrogen also plays an equal important role in case of silent heart disease? So basically what I'm trying to ask you here is, are females still at a lesser risk of developing silent heart disease, or is it same?
When we see the gender bias, premenopausal women definitely are at a lesser risk
Lesser
than the
risk.
males. But once the menopause happens,
Then it is equal.
then the risk of heart disease equals to the male counterpart. So the role of hormones like estrogen as a vascular protective agent is there, but this may not always be the scenario.
Acha, okay. So moving on to the next segment of the podcast, which is, I have few lines which can be a myth or a fact, or a few questions which I would want you to answer in a crisp way. So let's get started with that. So the first one is, can silent heart disease be reversed?
Up to certain extent.
Acha. So when we say up to certain extent, what are the conditions we are talking here?
Because when presented with the late stage, you have the limited choices of medical therapy. You may have the heart muscles weakened. They may not always be reversed, but in a few of the conditions, definitely they can be reversed.
Acha. Does a normal ECG rule out silent heart disease?
No.
Okay.
ECG may be completely normal in silent heart disease.
A normal stress test guarantees a healthy heart, myth or fact?
Stress test is a good specific test to diagnose the problem, but in a few percent, maybe even 5 or 10%, it may not diagnose the problem.
So it's not a guarantee for a healthy
not a guarantee.
heart. Only men are at risk for silent heart disease. I think I know the answer, but still.
Men definitely at a higher
At a
risk,
greater risk.
But even the risk increases in postmenopausal female as equal as males.
Okay. How often does silent heart disease strike without a warning sign?
in high risk individuals, as I mentioned, pre-existing heart disease or patient with diabetes, 30 to 50% risk of silent heart attack is there.
Achha. When silent heart disease finally reveals itself, is it already too late?
Yes,
Okay.
because the damage has already been there.
Mm-hmm.
He or she may have the blocks, and which may need more aggressive therapy.
More aggressive therapy. So that's where the difference in the treatment approach
Yes. So
comes in
earlier you
picture.
have the scope of lifestyle changes, you have the scope of medical therapies, but when presented late, you have limited choices.
Okay. Is wine really good for our heart?
It may be helpful, but it can also increase triglyceride. It can also increase the blood
So do you
pressure.
recommend wine or
So
no?
it's not an justification to use wine.
So wine is, I mean, I think it's more kind of a myth.
Yeah,
Yeah. Sitting is the new smoking. Your thoughts on that?
very true. Because sitting increases the weight, overweight, and obesity. We know that is a traditional risk factor for heart disease as well as other lifestyle related diseases.
That doesn't mean you go out for smoking as well.
Yeah.
Okay. You can't do much to reverse heart damage from years of bad habits.
It's no, false. I would probably emphasize that intervention at any point of time are good to prevent the further progression, to halt the further damage to any of the, be it a heart disease or any other disease. But definitely in a heart perspective, you can prevent the further progression of disease when even at the later stage.
Okay. So with so much of experience that you have, you bring on the table, and with treating patients from every, aspect of the society and culture, share some story with us which has been really challenging for you, and which has come out with good prognosis, which is the treatment outcomes.
I'll talk like in terms of a silent heart diseases. Majority of the time when individual comes to a check and he found to have the problems, then it's very difficult, become very difficult to counsel himself, his family members, his caretaker, that this guy has this problem and he needs to be taken care. Most of the time they may not accept the things, they may seek a second opinion, they may go for alternative therapy, but actually it may not work then. So yes, obviously I would recommend them to have a regular health checks. As far as challenging cases are concerned, recently I had one doctor's father who came for routine checkup, like ECG, and but when he underwent a stress test and echocardiography, there was abnormality. I did his angiogram, and that found a multivessel blocks, which was treated with the bypass surgery. He is doing great, but had he been noticed and went unnoticed, he would not have been able to continue with such a good lifestyle.
Achha. So that's how
That's yeah,
important
that's an
it
and this
is.
happened to an father of the doctor.
Father
Who,
of a
yeah,
doctor.
so it's
So I think awareness is kind of required at multiple level as
yes.
well. So what would be the final takeaway message for all our viewers on today's topic?
So I would recommend to have a regular health visits, specifically in individual with the diabetes, blood pressure, or patient with the old age, those who are having family history of heart disease. They should visit the clinician, physician, or cardiologist at least once in a year to check their parameters in terms of blood pressure, in terms of the blood sugars, so that any heart diseases would be addressed at earlier stage.
So that's about that, and that was today's topic, which was on silent heart diseases. But I wanted to really ask you one thing, that I have always seen you very calm, composed, and very quiet kind of a person. But that definitely doesn't sync up with the kind of routine that you have during a day, which is, running from pillars to post. So how do you maintain this, and how do you keep yourself so calm, in spite of working in a situation which is so tense?
So by branch, by a profession, you may not be calm always, specifically in dealing with the emergency cases. So apart from work, you should follow your hobbies and you should keep yourself happy by doing the activities which are really found helpful to you, like reading or whatever the activities make you happy.
That keeps you
Yeah,
happy. Okay, on that note, thank you so much for coming on Sahyadri Health Talks. It was wonderful having you, and a beautiful discussion, I must say. Looking forward to have you again
thank
on
you.
Sahyadri Health Talks. with some other interesting topic. Until then, this is Dr. Tushita signing off, Sahyadri Health Talks.